today I want to really focus on some very unique therapies and research that involve your immune system that actually could catapult your body to not only attack cancer cells, but keep them at bay.
When they looked at prostate cancer cells and they put testosterone next to some of them, but a stress hormone, cortisol, next to others, the stress hormone caused prostate cells to flare 300 times more than testosterone.
Typically, it's 5 to 10% that genetics play a role in cancer. So some patients actually say, oh my gosh, I'm destined to get cancer. And that's not necessarily true if you do the right lifestyle modification.
If you had a single cancer cell, you would never die from that. You'd be fine. Even if you had 10 or 20. It's when cancer gets so big that it begins to compress on other organs or take up too much space, that's when it becomes deadly. It's allowed to do that because it learns how to evade the immune system.
Welcome to Rethink My Health Radio show and podcast. Each week we come to you live from our studios in Atlanta, Georgia, talking about healthcare matters, about chronic disease that matter most to you, your family, your loved ones, your friends, and as I say time and time again, they do matter most to us, the research scientists, the practitioners, the physicians working in the trenches day in, day out. If you're a first-time viewer or listener, we welcome you to Rethink My Health. This show is about education. This show is about empowerment, awareness, hopefully giving you the tools to inspire you to think outside the box, to take action, to galvanize you into this action. My name is Dr. Gez Agolli, integrated practitioner, doctor of public health, working alongside different colleagues. And today is a very unique podcast and educational show because we are going to be discussing some innovative therapies and treatments that are making headway in the cancer community. Most of you out there, when you hear the word cancer, it's very, very scary. It's concerning, and traditional medicine has its place, and we've seen some great advancements in oncology, but we're still falling short. And we've seen cancer rise over the past several years, and we can discuss that as well. But today I want to really focus on some very unique therapies and research that involve your immune system that actually could catapult your body to not only attack cancer cells, but keep them at bay, which is really the goal. The ultimate goal, of course, is to go into remission, and everything has its place. And this is what we want to discuss today. And joined with me is my colleague, Dr. Cheryl Burdette. Thank you, Dr. Burdette. I know that we're going to be talking about this, but it's very, very important to understand that I mentioned this show and podcast is about education. It's not here to replace your traditional doctor or your practitioner, especially if you deal with cancer. But if you or a loved one has been recently diagnosed, you need to get all the facts. You need to understand that there's other treatment options. If you're at stage 3 or stage 4, or you know somebody, these are the type of therapies that you need to take a look at and possibly incorporate into your treatment protocol. So let's just jump right in. Dr. Burdette, cancer's on the rise.
Yes.
We've seen multiple patients. As a matter of fact, with cancer, I just recently returned from the American Academy of Ozone Therapy in Dallas. Dr. Frank Schallenberger, who is a forward-thinking physician out in Nevada, practicing for well over 4.5 decades. And he was sharing that he has never seen cancer rates so high. It was concerning for him as well. Mm-hmm. And they teach the benefits of oxidative therapies, but they also teach other therapies as well, and incorporating ozone and high-dose vitamin C and individualizing care. And these are all wonderful. But I also think there's a place for talking about the immune system. Now, traditional oncology, one of the greatest discoveries in the past couple decades is immunotherapy. And I think it's fantastic.
Absolutely.
But I want to take it a step further. We're talking about individualized immunotherapy made from either your own tissue, right, from a tissue biopsy, or a liquid biopsy, which we're going to talk about. So first of all, let's just do an overview about the immune system. Tell us a little bit about how immune system plays a role with cancer.
Yeah, absolutely. So normally our first line defense, also known as the innate immune system, protects us because every single day you have rogue cancer cells traveling around your body. It doesn't mean you're going to get a cancer diagnosis. On a day-to-day basis, our immune system is able to handle a single cell and weed it out, get rid of it, and make sure that we're keeping the body clear. There's a particular type of immune cell called a natural killer cell, and you can tell by its name. Part of why it's named that is because it's naturally good at killing off foreign invaders. And so this is part of the cells, the innate immune system, that we want to be out there and on surveillance so that they can recognize a cancer when it comes into play. One of the things that we know about cancer is that it has an ability to evade the immune system. It likes to change its shape or size or proteins that it's expressing on the membrane, normal things that immune cells look for to know who to attack and why. And so it will change those things to hide from the immune system. And so natural killer cells are very good at continuing to find a cancer cell even after it's made some of these changes. And so this is why we talk about keeping the immune system healthy, because every day we are weeding out cancer cells. Every day we have to be winning that battle. And on a day-to-day basis, 99.9% of the time we're winning that battle by keeping our immune system strong.
Absolutely. And there's no doubt, there shouldn't even be a debate in medicine about the role on your immune system, as Dr. Burdette was talking about. You have two immune systems, one inside the cell, one outside the cell. One has a memory, one doesn't. And there's a lot of crossover. And the immune system is very complex, of course. But it's tough to simplify the immune system because it is complex. But you need a very robust and balanced immune system to really keep these cancer cells at bay. And traditional medicine has been focusing a lot on destroying the cancer cells, of course. And we call that apoptosis. That's a natural ability to kill off these cancer cells and to get rid of the senescent cells we call zombie cells, of course. So it's a complex cell cycle life. The problem with cancer, it continually replicates and gets out of control. That's called mitosis. And that's one of the strategies we have to do. And your immune system has different components. And there's free radical scavengers. You have something called macrophages. That's kind of the lookout for these, and it can encapsulate certain cancer cells and alert the cytokine and natural killer cells to destroy them. But I also think it's important to understand that there's different strategies when what you're doing in traditional cancer is you're just focusing on whether it's just chemo or radiation and some immunotherapy drugs that they're using. You have to also look at what can we do naturally for the immune system. So there are some great strategies at Progressive Medical and other forward-thinking integrative oncology specialists that have taken a step further in their educational process and finding out strategies. One of those strategies is a gene silencer, and I want to talk a little bit about that for a second. It actually is interesting because rather than boosting the immune system, one of the strategies is that there's an organization called RGCC, and they have a very specific test that looks at circulating tumor cells, and it'll tell you what substances, medication, repurposed drugs, also natural therapies and treatments and certain IVs is sensitive to your cancer. Because one strategy, as I mentioned, is to destroy these cancer cells, destroy them. The problem sometimes is that you see a lot of specific side effects, of course, and some patients don't want that. There's a time and place for chemo and radiation, but then the body can't handle that. So this is a strategy on blocking these cancer cells from replicating, and then they go into that process called apoptosis. The QR restrain is a gene silencer made from your own blood. And I just want to give a disclaimer here. A lot of these therapies that we're talking about are not FDA approved. And it's a very interesting philosophy, because a lot of Americans think, oh, it has to be FDA approved, which is true. The FDA is there for a reason, to protect the American public. However, back in 2018, they did pass several laws called Right to Try. And Georgia happened to be the 12th state. I believe Governor Kemp signed that last year in 2025. It's called Right to Try. And Georgia is also known to be a right for freedom healthcare state as well. But the reason why I say that is that you have to go through clinical trials, phase 1, which is basically looking at the safety. But some of these therapies we're going to talk about are not FDA approved. Just want to give that disclaimer. It's important to understand that. That doesn't mean they don't work. Research really drives the advancements of healthcare. And this is just a very unique strategy. So I want everybody to know that as well. But the great thing about it is that functional doctors are always looking, integrative doctors are always looking for therapies that are innovative. And I think this QR restraint is one of those, because it's a gene silencer. And then, of course, we want to talk about dendritic cells in a moment, Dr. Burdette. So a little bit about QR restraint. It's a gene silencer. And basically, the research we have done, it's taking your blood, and it's actually made from your DNA, and it's actually a messenger RNA sequencing of the disease-causing agent. So it's stopping those, whether it's the cancer cells. There are also been some research from viruses as well, which we can make an argument that certain viruses can contribute to cancer. Tell us a little bit about this gene silencing, and a little bit about why would that be a good strategy.
Absolutely.
When someone's battling cancer.
Well, when we speak about getting to root cause, this is an example of that. We all know that mutations in the DNA are what initiate a cancerous change. We have free radicals out there, pollution, things from the environment, maybe different food sources, and it damages the DNA, and that's what sets us up for cancerous change. And so if we can use something that will silence the DNA at that root cause level where that change has happened, that allows that cancer cell to divide and to divide and divide for forever, then we really have a beautiful therapy that is either as a standalone or very synergistic with other styles of therapy out there. Now, in terms of thinking about things outside of the box that aren't FDA approved, look, I don't think it's radical to say that none of us out there are satisfied with cancer care as it stands today. And I'm including every oncologist, every patient, every person who has met someone who has suffered and died from cancer. That's just not radical to say that we know that we want these therapies to be available, but we would like them to be better, to be safer, to have less side effects. In fact, there are different restraints on even using some of these chemotherapies in other countries. Asian countries in particular will make the analysis that the care should not cause as many symptoms as the disease itself. And so there's more of a natural coupling with integrative therapies to manage side effects. But, again, it's not radical to say we're not satisfied with cancer care as it is until every person is able to beat that disease and not have a therapy that causes them to lose weight and their hair fall out and to have horrible energy and to throw up. Like, of course, we want to make improvements. And so this is part of that. And these improvements that have been looking at immune stimulating therapies or gene altering therapies are not new, or they've been going on for decades at this point. And so, again, the understanding that the DNA is an intimate part of this. And so one of the things that happens in a normal cell is it knows there's a certain time when I'm supposed to turn myself off. And that's called apoptosis. apoptosis, or some people say apoptosis, but that is a cancer cell remembering to die. And that's the difference, right? We know these cancer cells, they become immortal, whereas a normal cell only has a limited lifespan. And that's because of a DNA change. And so what happens with this therapy is from the blood, you can find circulating tumor cells, and you take that bit of the tumor, and then you're able to analyze exactly where the genetic change is. And so in general, when we think about, for example, how we use all therapies, we think about cancer types or genetic types. That will dictate a type of chemotherapeutic. That will often dictate schedules with radiation. So we're always thinking about these genetics. But now, if we could move it a step further, and the therapy itself addresses the genetics. So first, you figure out that person's genetic mutations specifically, because that's just it, right? Cancers mutate. They change all the time. That's part of why they stay alive so much. That's part of why they will escape various therapies. And then also, from the body's wisdom, there are signals that tell the DNA to turn off, that remind it to do what every normal cell should be doing. And so from that same blood sample, you'll look for those samples, you'll look for those signals that have often been suppressed by the cancer. And now outside of the body, you grow those signals up, and then you use those signals from the body's system and put them back in as an IV after you've amplified them. And now essentially what you've done is you've put the system back in balance, because the cancer found a way to override these normal signaling mechanisms to get out of balance. Again, every day we turn off cancer cells. It's just when it gets out of balance and it gets bigger and bigger, the immune system can't handle it. And so this is a way to target that person's DNA very specifically to turn off the genetic signaling that's causing a cancer cell to live forever, which it shouldn't do.
Absolutely. And that's one of the goals, to get back into apoptosis, which is natural cellular death. And I like this strategy, Dr. Burdette, because it's basically taking your blood, it's monitoring it, it's creating this RNA sequencing, which blocks the cells from turning over, replicating. It's just a very unique strategy. And according to the RGCC, and they've done research over the past decade or so, and they're a big research organization, is that it's got a 78% success rate based on blocking this. And some of the parameters, of course, is that you have to have the right tumor burden size. It has to be less than 5 centimeters. There's certain requirements. You can't do certain therapies within 14 days. Once again, it's very individualized as well. Those of you that are suffering, unfortunately, with brain tumors, this does not pass the blood-brain barrier. So if you have a brain tumor, I'm sorry, this type of therapy would not fit into that category. There are some other therapies, though, we'll talk about. One of them is called dendritic cells that may be a candidate. We'll talk about that after the break. But I think the gene silencing is a fantastic strategy. And that's something that if your loved one is suffering and you're looking for the different strategies, it's always a good idea. You can talk to your physician about this. This is nothing new that we're talking about. They've been doing this research as well. It's very safe if you fit the parameters, and it's just another toolbox. And once again, you just can't do one thing with cancer. What we've learned over the past several decades is that you have to do multiple things. Number one, find out, if possible, the potential root cause. If a virus is very high, which is interesting, is that this also works on viruses. It can target that as well. And they have a very high success rate. I believe with viruses, it's about 91 to 95% success rate. That's amazing, because viruses are very, very, very difficult. It's going to inactivate that virus. And so when that virus is inactivated, it can't wreak havoc on the body, because what ends up happening is that when your immune system goes low, if you have sleep deprivation, if you have emotional stress, other physical stressors, chemical stressors, your immune system just doesn't function as properly. And this is when these viruses come out. Most Americans, I believe it's well over 75%, are exposed to Epstein-Barr virus and cytomegalovirus. And it's clearly been documented that Epstein virus, when it's out of control, does contribute to cancer.
Absolutely.
And it's really important to understand that.
Lots of viruses do.
So that's why we want to look at root causes, looking at certain infections, looking at multiple chemicals, and also looking at, your genetic component. And I think genes are very important to take a look at, although they've established, Dr. Burdette, over the past decade or so, that typically it's 5 to 10% that genetics play a role in cancer. So some patients actually say, oh my gosh, I'm destined to get cancer. And that's not necessarily true if you do the right lifestyle modification and do the proper therapies to prepare your body. And I love what Dr. Schallenberger said at the American Academy of Ozone Therapy. He basically looked during his presentation to well over, I think it was about 350, 400 different practitioners attended. And he looked at them and said, don't get cancer. And the best way to treat cancer is to don't get it and prevent it, because it disrupts your life. It's very, very challenging. And I have compassion for those of you that are battling cancer out there. There's no right answer. And we're not certainly saying, oh, cure, restrain is the cure. No. It's another strategy that you should consider, because we've seen so many patients go through rigorous 5, 6, 7, 10 rounds of chemotherapy. We had a patient coming in talking about their oncologist, which is very well-meaning, said you're going to be on chemo for the rest of your life. And that to me is just not a great strategy. I think short-term, depending on your cancer, but there's no other strategy. We just can't accept that you have to be on chemo for the rest of your life. Now, certainly there's certain medications you have to be on. We're all for repurposed medications, but we need to look for strategies that are safe, that are effective, and this is going to happen with research. And we're very fortunate to live in 2026 right now, because some forward-thinking researchers are out there doing that. And that's powerful.
Absolutely. And these are not just made up speculations. We can go to the data-driven research. We can look at studies where various IV nutrients, where various supportive therapies extend life, improve quality of life. And really, that is something that is often overlooked and is certainly so synergistic with any therapy at all. We also want to be thinking about, how are we building the person? We can't reduce a human being to merely a diagnosis or a cancer. And so this is, to me, the beauty of integrative medicine is, yes, absolutely, we want to attack. We want to kill cancer cells. We want to know what types they are, right down to their genetic differences, and work on that part. But at the same time, not lose sight of the fact that there is a human being there, and we need to do things that will build that human. We need to talk to them about what they're eating and stress response, because, for example, when they looked at prostate cancer cells and they put testosterone next to some of them, but a stress hormone, cortisol, next to others, the cortisol, the stress hormone, caused prostate cells to flare 300 times more than testosterone. And so, for example, a standard of care would say, let's do a hormone blockade. But if we're not even thinking about stress management down to those hormones that can be even more stimulating, if we're not thinking about diet and lifestyle interventions, if we're not thinking about the human being who is holding this diagnosis, then we've missed the most important and the most advantageous way of treating somebody in this situation.
Absolutely. One size does not fit all, of course. And I totally agree with you. From that perspective, that's why you have to be evaluated from head to toe. And that's why functional integrative medicine is going to take the time to do a deep dive. And if you're just battling with cancer and all you're doing is focusing on the cancer, and I understand that's important, but there could be other factors that could be contributing to this. And that's a great example. And functional doctors will evaluate your cortisol levels. They'll end up doing a functional test that's look at the circadian rhythm with 4 different specimens. So that's a great analogy. Hey, this is Dr. Gez Agolli here at Rethink My Health. We are tackling on challenging, difficult topics. Cancer is one of them. One size does not fit all. You're individually made by your maker, and we're looking for individual strategies. We're talking about QR Restrain, which is a gene silencer. Fantastic strategy. Find out if you're a candidate. Talk to your practitioner. If you're in Georgia, of course, Progressive Medical has fantastic practitioners that have studied this. They are certified by the RGCC. Find out if you're a candidate. If you're not a candidate for QR Restrain, there's other strategies as well. It involves looking at a blood test. It involves looking at circulating tumor cells and finding out what therapies That even includes traditional medications, repurposed drugs, and natural therapies that block. So this is a different strategy. One strategy, kill, which we know is apoptosis. Other strategies, block and get into natural apoptosis. So once again, I think it's very, very important. When we get back after the break, we'll be taking a break shortly. This is Rethink My Health, sponsored by Progressive Medical Center. We thank you if you're tuning in for the first time. If you're a loyal listener, we thank you as well. We're always looking for cutting-edge information to bring to you. When we get back shortly, we're going to be talking about other strategies. We're going to be talking about more about the immune system. We're going to pique your interest with something called dendritic cells, which I truly believe is on the forefront of some amazing discoveries. There's been research all over the world talking about dendritic cells. I know there's lots of studies going on in the United States and in Mexico, and we're excited about it because there's also two different strategies with dendritic cells. And we get back, Dr. Burdette, I know we're going to be talking a little bit about that, but I want to just give you some words of encouragement and some hope. If you or a family member are battling cancer and you're losing hope, there is hope. Don't ever give up. Do the best you possibly can. Lifestyle medicine, whether you just decide to do traditional medicine on its own, that's your decision. It's your body, it's your temple. But lifestyle medicine makes an impact. It makes a huge impact on how the quality of your life, which to me matters most than anything else, the quality and how you become resilient. So don't lose hope. Hey, Rethink My Health. We will be back in a moment.
Let me ask you something. Have you ever felt like you've been doing everything right, seeing doctors, trying medication, changing your diet, but you're still not getting real answers? At Progressive Medical Center, that's exactly who our team sees every day. We work with people who are tired of being told their labs are normal, but they don't feel normal. Patients dealing with fatigue, brain fog, hormonal imbalances, weight struggles, or chronic conditions that are just not improving. Our approach is totally different. We don't just manage symptoms, we look deeper. Using advanced testing and a functional medicine approach, we help uncover why your body's out of balance and create a plan that's specifically tailored for you. Now, I'll be honest, this isn't a quick fix. Real healing takes time and it takes the right strategy. But if you're ready to finally understand what's going on with your health, we're here to help guide you. If this sounds like you, I invite you to take that first step. Visit us at progressivemedicalcenter.com and let's start getting you real answers.
Welcome back. Rethink My Health. Dr. Gez Agolli here, integrated practitioner, doctor of public health, here to give you more information, more awareness about strategies. We've talked about cancers on the rise. Well over 2.1 to 2.2 million Americans are going to be diagnosed. Cancer's on the rise everywhere in the world. We talked previous shows about why, but I want to focus about immune strategies. And just to touch up, I do believe cancer will continue to be on the rise, so we definitely need better strategies. I know a lot of research scientists and oncologists have been doing a fantastic job looking for different strategies, but we're still kind of into that treatment protocols and based on this. And some integrative practitioners just want to bust through that, and they're looking for innovative therapies that just kind of make more sense on looking at root cause. So we believe that immune system is critically important in how you battle, whether you choose to do traditional therapies, whether you're in and out. What's great about 2026 right now is that patients that are suffering with stage 4 cancer and they've lost all hope, they've exhausted chemotherapy, radiation, they've exhausted clinical trials, and they're basically looking for answers. What's nice, Dr. Burdette, is that the FDA's allowed something, and I applaud them for this. It's called the right to try. And dendritic cells is in kind of in that area where they've gone through some clinical trials and they're still waiting for the approval process, and the research is still ongoing. But dendritic cells seem to be very promising. There's two trains of thoughts with dendritic cells. There's certain companies and organizations that are doing research. One of them is in Mexico called Immunosine. They're doing amazing research, and they're basically taking your tumor, whether it's during biopsy or whether it's during surgery, and it has to be taken very specifically, and you can't use certain preservatives. So it's very, very important that if you are battling cancer and you are looking for these strategies, make sure that whenever you talk to your surgeon, if you want to save some of the tissue for these potential treatments in the future, it has to be collected correctly. And there's certain preservatives you cannot use, and each company is different. I know there's an organization in South Carolina that's doing this as well, and they've done research, and we've been talking to them. But they take it, and then they can make a dendritic cell vaccine from that tumor. There's other organizations that we work with, RGCC, can take your blood from a liquid biopsy and make it. So 2 trains of thought, they both are very interesting. We can't really give you an answer which one works better. We say that it really depends on your circumstances, of course. If you're not a surgical candidate, or if you have a blood cancer, then dendritic cells from a tissue is not going to work because you don't have that. But you can still look at strategies from liquid biopsies as well. So, Dr. Burdette, I'm fascinated with dendritic cells, and it's a form of immunotherapy designed for your body to fight the cancer by boosting your immune system. So let's be very clear here. Dendritic cells are special immune cells that act as messengers, and they identify harmful substances such as cancer. So your body has dendritic cells.
Yes, absolutely.
It's kind of a crossover between innate and humoral. It's a kind of a crossover because it's one of those areas where they're kind of in both areas. So it's fascinating.
Yeah, absolutely. So when we think about cancer, again, if you had a single cancer cell, you would never die from that. You'd be fine, even if you had 10 or 20. It's when cancer gets so big that it begins to compress on other organs or take up too much space, that's when it becomes deadly. And it is allowed to do that because it learns how to evade the immune system. And so anything that we can do to help the immune system recognize a cancer is really, again, getting to the heart of the issue in terms of being immune stimulatory to really build the system. So we can do that through diet and lifestyle, and then we can get right down to the nitty-gritty of how do we get your immune system to recognize this cancer. So this is very fascinating technology, and so I love it when we get to meet with people even before they have a surgery for a cancer. That is fabulous. So if you know a friend who is in that situation, saying, well, we'll wait till it's removed and then we'll think about what we're doing next. Please don't, because there's a lot that we can do beforehand if we get to meet with you. So first of all, anytime there's a biopsy or surgery, there's a chance that you could free cells into circulation. So there's things that we can do pre-surgery to help to reduce that risk. There are things that we can do around surgery to help speed healing. But if we know that you're going in to have tumor removed, then you can literally save that tumor, and we can do a couple things with it outside of the body. So one thing that you can do with it outside of the body is you can test it to see what it responds to. So rather than testing inside your body, we're going to use a number of chemotherapies till they don't work. Then we're going to maybe use a various number of natural agents. We'll see how they work, kind of just guessing based in general on how cancers respond. You can literally take a piece of your tumor and then measure different chemotherapeutic agents, measure things like turmeric or green tea, and get a sensitivity to what it responds to. But now, the next thing that you can do is you can take a piece of that tumor and you put it in a dish, so to speak, with immune cells, and you teach those immune cells outside of the body to recognize that tumor. And when you see ones that are doing, for example, really well at attacking, you take those, you divide them more, you train them more. And so you can literally train immune cells outside the body to recognize that very specific tumor. And now you put them back in the system. So now if you're sitting there and you're saying, oh my gosh, I already had surgery, I don't have access to my cancer tissue anymore, that's okay. These technologies have evolved that we can still do some of this even without the tumor. But when we are able to work with somebody from from a beginning process to really help them manage the surgery and all these pieces of it, that really helps to tilt things in one's favor. And this isn't an either or. These are things that can be combined, they can be standalone, but we want to do something that boosts the immune system, and training immune cells to recognize your tumor is the most specific way of doing that.
I think, thank you, Dr. Burdette. I think that the way to think about this is targeted. This is targeted from your specific cancer. And this is what's exciting, is that the research is moving towards targeted therapies based on your genetics and taking, whether it's a liquid biopsy. So if you ever had the surgery and you can't get the tumor, or the tumor wasn't frozen properly, and I understand there's certain parameters, this is something that you can get a blood test and it measures your circulating tumor cells. And that's something that you can get dendritic cells. And it's a series of 3 different IVs over a period of time. There's certain requirements, of course, and there's certain parameters that to see if you qualified. And that's why you have to go to a practitioner that's certified and accredited through the RGCC for that strategy. There's other companies out there and other research laboratories that are doing research with actually taking the tumor and specifically using a very unique technique with cryotherapy. I know that Dr. Pete Sulak, who has been our colleague and one of our consultants, and he has been battling glioblast or grade 4 astrocytoma, and basically he beat cancer. And one of his strategies, not only detoxifying and getting to the root cause and all these wonderful therapies that he did at Progressive Medical, basically he did use dendritic cells, and he actually took part of his tumor and he went to Immunosine, and they injected him into the, I think close to up in here in the vascular area that went past the blood-brain barrier. And that was really, really exciting. There's other companies right now that can actually do it intradermal. I was speaking to another organization, but there's some great strategies here. And once again, this is taking your own tissue sample and it's making these dendritic cells. And this is exciting research, Dr. Burdette.
Absolutely.
I actually am so excited about this for the future of cancer patients. It's just another strategy. Once again, we want to be very, very clear. None of these therapies that we're talking about, whether it's cure restraint, which is a gene silencer, or dendritic cells, which is part of your immune system. That's what's unique about this. And as Dr. Burdette eloquently described, it's taking your genes, making that specific dendritic cell to recognize your cancer cells and hopefully stopping them at bay. And nothing's a panacea, but these are great strategies. But I just want to be very, very clear. None of these are standalone, right? We believe that you have to do multiple treatments, whether that's boosting your immune system with other factors, whether that's changing your lifestyle. It doesn't mean you're doing dendritic cells and you have a bad lifestyle. No, when you have cancer, you have to be vigilant. I know it's difficult. It's very difficult. And one of the great things about this strategy is that there's a lot of patients that are battling cancer. They have something called treatment fatigue. You've been sitting there, whether you're going to your doctor's office, getting an IV, doing this therapy. It's exhausting, right? So I am excited about this because you can go through all these different therapies, and then doing this could be a game changer for certain patients with the cancer. So that's exciting.
Absolutely. I mean, and again, it gives people additional options, because until we are at a point where we have 100% survival with therapies that don't make people sick, we should be looking for additional ways to help people. And also, like we mentioned, this is just so very synergistic because it gives us a way to specifically stimulate the immune system, to train the immune system to overcome what cancers are very good at, being tricky and doing different immune evasions. And so this advancement of not even necessarily always needing tumor when it's removed, but being able to get this from a simple blood draw has really moved these therapies forward. And so much of cancer research and cancer therapy has been saying for years that we have to recognize the immune system, that we have to help the immune system in terms terms of overcoming. We can't just work to kill cells, because the problem is, of course, as we do something that's toxic to a cancer cell, it can be toxic to a non-cancerous cell as well. So all those things that can help just to tip things in favor of the patient, and immune stimulating therapies are a perfect example of that.
And that's what I like about this, is that, once again, when you're looking at certain therapies, and we talk to different oncologists, and, one of their biggest concerns, of course, is the side effects, and they try to mitigate that. But there's some great strategies out there to mitigate that. Dr. Walter Longo, we've talked about this in the past, has done studies when the proper amount of fasting is done before chemo, which I think is really, really good. You go into something called autophagy as well, and hopefully get into apoptosis. But the cells become resilient. And that's why lifestyle really does matter. And if you're seeing a traditional oncologist and they don't have another team with nutrition or cancer coaching or a functional practitioner, I want to encourage you to do that, because it's so important to become resilient. And the body has over 30 trillion cells, and you've got to protect those good cells, right? Because these good cells are going to help you recover. And that's why we believe that dendritic cells will play a role in the future of cancer. We believe in the next 5 to 10 years, based on the trajectory of this research, that this will become standard of care. We're just not there yet. So the great thing about it is that you don't have to travel across the world, although there's some great clinics in Germany, there's some great clinics in Mexico. With this Right to Try Act, you can do a lot right now in the United States. So this is really exciting times. I want to be very clear. Nothing's a panacea, of course. Everybody's individually treated, and you have to be evaluated effectively. But I just want to reiterate some of the benefits that we have researched and seen firsthand of dendritic cells. Number one, targets the cancer cells specifically and reducing harm to healthy cells. This is very, very important, because when these cancer cells constantly are replicating and the cell cycle does not stop, okay, it's going to become a tumor, or it's going to evade, it's going to metastasize, and that's what stage 4 is metastasize other parts of the body. And then you start to see these particular devastating side effects. Number 2, boosting your immune system, that you're fighting the cancer more effectively. Number 3, may prevent and help prevent cancer reoccurrence by creating a long-term memory strategy. Here's the key. How many times have you heard someone, hey, I'm cancer-free, I've had 6 rounds of chemo, everything's fantastic, it's great, we're all happy for them, we applaud them. Most research scientists know that's short-term, unfortunately, and sometimes 2, 3, 4 years, the cancer comes back. This is another strategy that after you go through all your chemo, that you need to now rebuild your immune system. And we believe in the future that after the research is all said and done, that this is going to be standard of care for the majority of cancer patients. That's going to be exciting times. We're not there yet, but the good thing is that this is available.
Well, we'd love to. Maybe you had a stage 1 or a stage 2, and you were able to remove it, and they said they got clear margins, and so you're in remission, and you're likely going to stay there for a long period of time. That is a great time to come in and talk about what are you going to do to stay in remission. So, for example, doing something like high-dose vitamin C IVs can be hugely helpful at that moment in time, because if there were some rogue cancer cell out there, that vitamin C can be used to tap those down, and at the same time protective for good healthy tissue, working in terms of what are you going to do to be stress resilient in your life, meaning that you can't avoid all stress in the future. But we talked about earlier in the show how stress can be one of the major triggers to a cancer cell. It's not always, estrogen, testosterone, but those stress hormones are hugely impactful. Then what can we do to make sure your immune system stays as boosted as possible so that your first line defense doesn't go down again? And it turns out that one of the best ways to boost your immune system is not, from a mushroom or from a vitamin or from any kind of pill, powder, or potion, but it's from you. And so working with you in terms of where is most of your immune system, well, that that is in the gut. That is 85% of your immune system. And what is in the gut primes the immune system in the rest of your body, that innate immune system, those natural killer cells. So if we can work with you and help your microbiome and work with you on foods you're eating, we can prime that 85% of the immune system that is you, and that's signaling the rest of the body. So you could have the sexiest, most cutting edge cancer therapy out there, but at the same time, if someone's not talking to you about what you're eating and how you're being resilient in the face of stress and what we're doing to boost your immune function internally, then there's some very underutilized strategies that, again, go back to building the person, which are the heart of integrative medicine.
Building a person is the heart of integrative medicine, and that's well spoken, Dr. Burdette, because I think that's going to be the key. This is exciting stuff. Hey, listen, if you're listening to Rethink My Health, you have a friend, a family, loved one, or yourself and you're battling cancer, you've been through traditional therapy, and your oncologist is saying, hey, that's all we can do right now. Or if you're right in the middle of it, I want to encourage you to start looking for some of these innovative therapies, whether it's dendritic cells or QR restrained. Find out if you're a candidate for any of these specific therapies as well. Going back to some of the benefits, number 4, dendritic cells are much better tolerated with fewer side effects compared to traditional therapies and chemotherapy. There are some potential side effects. We'll talk a little bit about that as well. And number 5, this is what is really exciting. You can actually combine dendritic cell therapies with either chemotherapy or traditional immunotherapy for better results. So just because you're doing chemo, and listen, we want to respect the oncologists because they're battling cancer and they're seeing a lot of very devastating case studies and cases and patients. It's challenging. It's very difficult. And they have their wheelhouse and they're focused right here. But they constantly tell patients sometimes, hey, just do this. And we encourage patients to talk to their oncologist, say, hey, is there anything else I can do? And we just seen so many studies when you combine it, there's better results. One size does not fit all. We believe that you have to have several different strategies because cancer cells are resilient and cancer cells actually adapt. And cancer cells could 1 month be feeding off glucose and the next minute they're hijacking your mitochondria or they're hijacking fatty acids. So you have to use these strategies. And we just can't say, you just can't do this with diet alone. You can't just do this with medication. We believe that you've got to take these kind of strategies, and dendritic cells and or this gene silencer could be a great component. Going back to the gene silencer for a minute, I just want to be very, very clear. Based on the studies with RGCC, with cancer, you can do up to 4 years. Typically, some patients do 2 to 3. It's up to 6 months. It's working for up to 6. So if you decide, if you're a candidate for the QR restraint, the gene silencer taken from your blood, and you do that strategy, basically they have a 78% success rate that up to 6 months, it's sending a message to stop the cancer cells from replicating. And that's a great time to do other therapies as well.
So you're not coming in every day for that. You're
Absolutely.
Just coming in.
And you're doing other therapies as well to do that knockout punch. And you can continue, because the goal is to get down to as low as possible circulating tumor cells as well. And the great thing now is that there's some fantastic diagnostic testing. You have ctDNA that's looking at the DNA that'll alarm your doctor to say, oh, wait a minute, your cancer is coming back, and you have these CTC, circulating tumor cells. Okay. Hey, Dr. Burdette, we only have a few minutes, and I just want to briefly talk about another therapy that just came out recently with RGCC. It's called ClaviQ-RE, and that's just another strategy. It's basically taking the blood. It's an immune activation, but it has a multi-pathway attack of macrophages, natural killer cells, activating dendritic cells, and cytotoxic T cells that work together for targeting. So it's doing all of that. This is exciting. It's something brand new, but it's personalized. Why is it important, do you think, for some patients to consider that as well? Because it's looking at all those areas of the immune system, macrophages and cytotoxic T cells, immune activation.
Yeah, so let's just back it up for a second. You're talking about RGCC, and so I just want to let people know that this is a company in Europe that Progressive works with, and and they got their start by looking at, can we take tumors and can we measure that? Can we look at things outside the body to see what would be most responsive? So it's not even just a single therapy, but being able to test a cancer cell to see what you are going to respond the best to. So maybe even this show is confusing because these silencing genes and turning on your immune system both sound very promising. They are, but we can take your own blood, your own tumor cells, and tell you which one of those things have a higher probability of being successful for you. And so we start there, and then from there, able to develop all these various strategies. And so if we can turn on different cytokines, and if we can silence different parts of the immune system, then that's another key way to keep the system from being too inflamed, to put the immune system back in balance, to remind those white blood cells to what a cancer looks like so they know how to turn it off, but also to remind the cancer cell that you're not supposed to divide forever. So it causes the cancer cell to arrest in certain stages so that they're not continually replicating, continually dividing, and that gives the immune system a better chance to slow it down and kill it off. So a huge amount of synergy between these strategies that you're talking about, and all in a backdrop of how do we also build the person, change the diet, work with diet and lifestyle, bring the most cutting edge therapy, but also harken back to Hippocrates, who said, let food be thy medicine. And when we combine all of those things together, this is what gives the best outcomes.
Thank you, Dr. Burdette. Let's go full circle right now. So great show talking about immune system, battling cancer, looking at all different factors as well, whether it's a gene silencer, QR restrain, whether it's dendritic cells, whether it's from a liquid biopsy dendritic cells, or it's taking a piece of your tumor. I encourage you, if you're about to have surgery or biopsy, talk to your doctor about freezing this properly, at least have that available if you need it. And then obviously this new Clavicure QRE, it's fantastic because it's activating your macrophages, cytokiller cells, natural killer cells, T cell. All of this is fantastic. And these are great strategies. My words of encouragement are this: do something, work together with the team, think outside the box. And we know that this is a journey, and we're here to help you out. Dr. Burdette, thank you so much for joining us on Rethink My Health. It's been so exciting. And I just want everybody to know a cheerful heart is good medicine, but a crushed spirit dries the bone. God bless you. Be cheerful. And we're going to see you next time on Rethink My Health, getting to the root cause. God bless you.